Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
This Thanksgiving, join hundreds of runners and walkers at Wichita's favorite holiday tradition, the Say Grace 5K. Get ready to move for a cause that matters. Whether you're running, walking, or strolling with loved ones, every step helps support GraceMed Health Clinic in providing quality health care to those in need. Cross the finish line, make memories, and celebrate a meaningful Thanksgiving with us. Register today at saygracerace.com. See you at the starting line.
Welcome to MedTalk. Hi, my name is Juvenava, Director of Community Outreach and Communications at GraceMed. Welcome to our first episode of our new podcast, where we're going to talk to community organizations, partners about the services that they offer and how they also help the community with accessible healthcare or other needs. Our first guest is Diego Romero, Project Coordinator for GraceMed Health Clinic, who is in charge of Healthy Kansas Kids Project. Hi, Diego.
Hello.
How are you?
I'm fine, thank you. How are you?
Good. Well, thank you so much for being here with us. Talk to me a little bit about Healthy Kansas Kids and what the mission of that program is.
Healthy Kansas Kids is a program that is funded by CMS, which is the federal government. Mm-hmm. And our whole purpose is to find families with children under the age of 19 and help them enroll with KanCare, help pregnant individuals, and help those parents that may qualify apply for Medicaid. Mm-hmm. We do have 29 counties that we go to, and we have 4 reps or community outreach reps. That's what we call them. Mm-hmm. And they help individuals in person, through the phone, online. And we just want everybody who is supposed to have Medicaid to get Medicaid.
Why do you think this program was so necessary in Kansas? Was there a need for people to get assistance with Medicaid? What was the purpose of this?
Well, Kansas is no longer has regional offices. Okay. There are a few outstation workers, but they're not everywhere. Okay. So the need is definitely there for the message to get out about Medicaid and to help families enroll. Mm-hmm. So that was the main, I would say, mindset with GraceMed to start this program, was to go out there and fill that kind of void that the regional offices left.
Okay. So just to be clear, Healthy Kansas Kids is the project or the program, right? Correct. And Medicaid, which is KanCare, Medicaid is the actual insurance.
Correct. Okay. So in the state of Kansas, Medicaid is called KanCare. Each state gets to name their KanCare or their Medicaid program, but we've chosen KanCare. Okay. So there are 3 companies that the state contracts with. At this point, it's Aetna, United, and Sunflower, and that is what KanCare is. It's basically, it works the same way as private insurance, but it's through the state.
Okay. For those who might not know what Medicaid is, can you tell them what Medicaid is?
It's comprehensive health insurance. It does get some funding from the federal side and the state side. So the state manages the program, but basically it's medical, dental, and vision for children, adults, and pregnant women. Now, programs and coverage may vary depending on who it's covering, but generally medical, dental, and vision.
Okay. So obviously, in order to qualify for Medicaid, it's gonna depend on the situation, right, of the family. What are some basic eligibility requirements in order to qualify for Medicaid?
So to qualify for Medicaid, you must be a resident of the state of Kansas. You must meet citizenship requirements. There are also income guidelines. So it's a means-tested program. Most federal and state programs are. So those would be the main qualifiers in order to be able to get Medicaid. And of course, we have not expanded Medicaid, so some adults are still not eligible, but the most common categories, children under the age of 19, pregnant individuals, caretakers of children under the age of 19, and elderly and disabled.
Okay. Is there an income guideline that they have to meet?
Yes. So the income is going to run from 0 to 255 with the families with children's program. So we focus on that with Healthy Kansas Kids, kind of with the name of the program.
Yeah.
So we are not dealing with the elderly and disabled side. So income will vary depending on the program. But for families with children and for the children themselves, it's 0 to 255. For pregnant women, I believe it's 0 to 174.
Okay.
And for caretakers of children, it's 0 to 33%. And the percentages that I'm quoting are federal poverty limits.
Okay.
And that's information you can find on the internet.
Okay. Is there a specific website that they can go to find that information?
I think if you just go to a search engine, Google, the most common one, I would say, you can just type federal poverty line or guideline, and it would come up. But you can also go to the the KanCare website, and you should be able to find it on the KanCare website, which is KanCare.ks.gov.
Okay, perfect. There might be some misconceptions about Medicaid. What are some of the biggest misconceptions that you've heard about Medicaid, and how would you fight those misconceptions?
Well, that some people may not qualify due to citizenship requirements. Right. That could happen, but at the same time, if there are individuals that do qualify, they shouldn't be afraid to apply. So there's mixed statuses in families.
Yeah.
Not everybody qualifies just because they're a U.S. citizen, and income is always taken into consideration. So in order to qualify, it just doesn't necessarily mean that just because you're working, you don't qualify.
Right.
So within Medicaid, there's the Medicaid, and then there's the CHIP program. So, for example, in a household of 4, for the children to qualify, you can make up to close to $80,000.
Oh, wow.
And they would still qualify.
Okay. That's interesting. That's good to know. And I think I was just going to mention this, is that I think sometimes people don't understand that it really depends on the situation. So that's why it's so important for people to ask, maybe reach out to you to see if they do qualify, but to definitely check. What are the benefits of being on Medicaid? Like, I know some people might worry that, was that the same thing as private insurance? But can you talk a little bit more about the coverage that Medicaid has? So the state did privatize KanCare. So when you have the managing companies, Aetna, United, and Sunflower, it basically runs like private insurance. You still have a network. You still have to follow guidelines in order to get services. So when you look at it, it looks like private insurance on the front end, but also, I mean, it would be the same way. So if you're wanting to see a doctor, you would have to make sure that doctor is in network. I want to have a service. Did you get pre-authorization to have that service? So prescriptions, are they covered under the formulary? So it would mirror private insurance. So if you were used to having it, then that would be something that you could go from that to Medicaid. But also for individuals that have never had insurance, it tends to be a little harder to try to tell them, hey, you just can't go wherever you want to go. You have to make sure that you're in network. So that's one of the things that when we sit down with somebody, we'll try to explain to them and just, once again, help on an individual basis depending on what that person understands about insurance. Okay. Earlier you had mentioned that caregivers can apply for Medicaid for children and maybe even for themselves. Can you explain what caregivers means? Well, the caretaker program, caregiver, some parents who are in the primary caretaker of a child under the age of 19. So it doesn't necessarily just mean parents. It could be a grandparent. It could be an aunt, an uncle, a brother, or a sister. So do you have a child under the age of 19? Are they receiving Medicaid? Are you making below 33% the federal poverty limit, which is the income guideline? Then you could have coverage through the state of Kansas while you're taking care of this child. Okay. And so going with that, so can an aunt and uncle who perhaps is taking care of a child, or even a grandparent taking care of a child, can they apply for Medicaid for that child? Yes. So people that can apply for Medicaid, they have they have a set of rules. So are you the parent?
Are you of any relationship up to the 5th degree to this child? Are you a guardian? Are you a conservator? Are you planning to claim that child on your taxes? Those are people who could fill out a Medicaid application. But let me just be clear. Anybody can fill out a Medicaid application. So nobody should ever be denied the opportunity to fill out an application. I think the question is, will it get approved, and would you be able to apply for that person? But you should always be able to fill out a Medicaid application.
That's really good to know. My other follow-up is, why is Healthy Kansas Kids so unique?
Well, we've been doing Medicaid here at GraceMed since probably 13 years now. Yeah. We started out with the presumptive eligibility program. So we're a qualified entity. Presumptive eligibility is a quick way to get KanCare. So if you come to the clinic, we can identify you, let's say a child that needs to be on Medicaid. We can do a really quick tool, and we can get Medicaid. But we have that much experience. We've got a memorandum of understanding with the state. The state knows that we're doing this. We've built a lot of partnerships and friendships that are very resourceful or helpful. So we have that rapport already where we can help you and advocate for your application to be worked as quickly as possible.
And I think you mentioned earlier that you have community outreach reps who go out in the community and have partnered up with other organizations and even other clinics to help people in those communities, in those counties that perhaps a GraceMed's not at or in, to assist for the Medicaid application. What does that entail? Like, how does that happen?
Usually when we partner up with somebody, they kind of align with the mission of, we work with families, they're needing to get medical coverage. So what we do is we basically set up a table at their lobby in an office, a spare office they have. Then we start advertising that we're there, and then we just help whoever comes. So they've been really helpful in telling their consumers or their patients to let them know, hey, these people are here to literally just help you apply for Medicaid. Come see them, and then that's how it starts.
Yeah. Okay. Awesome. And do you have staff that can assist with like Spanish-speaking families?
Yes.
Okay.
3 of our staff members are bilingual. 1 is not. But I'm bilingual as well. So, yes, we can help in Spanish and English. When we cannot help, we will send you either to the KanCare line, which does have many languages. So they will be able to assist pretty much in any language that hopefully is out there, or at least in our area.
Awesome. Well, before we end the interview, if people are wanting more information or resources or anything like that about Healthy Kansas Kids, or if there's maybe agencies that want to partner up with you, where could they go?
They can go to our website. It's healthykansaskids.org, and they can reach me directly there. And then we have our number. I don't know it off the top of my head, the 1-800 number, but this number also works as well, 316-977-9315.
Awesome. Well, thank you so much, Diego, for meeting with us and talking to us about Healthy Kansas Kids. Again, thank you, everyone, to all of our followers. Until next time.